Hi, I'm Todd. I've been seeing Dr. Matt over the last year. Recently today for a checkup, but for about, what was it, a month or so?
Yeah.
No, 2 months, I think.
About a month or two.
Yeah. And I've seen chiropractors, I've seen occupational therapists, and those two were somewhat helpful, but physical therapy to me is a more comprehensive science-based approach where the therapist, and in this case Dr. Matt, which is definitely the case, their knowledge of physiology is very extensive, and so that in advance they know what they're looking for, and when they're activating nerves and muscles and joints, they actually know what they're looking at as far as the system goes, and that's really critical. So when they're doing something, they're looking for certain results, and both the negative and the positive. And so when it doesn't work out like it's supposed to, it really helps them diagnose much more quickly, and then at the same time treat you right there during the session. So you don't get that. It's more of a trial and error thing. Well, we're going to try this for a while, see if it works. He has a feedback loop right away that occurs that I don't see with the other approaches. And so on every session I saw progress, some more than others, but that's to be expected. The other thing that's critical is they really emphasize that we really have to, number one, be knowledgeable as we can, so we understand what's happening physiologically as well. But also there's exercises that we need to do to really have progress. And I must say I'm not as good at that part of it. I'm getting better, but I know how critical that is. I'm seeing coaches for training, and they do some of that for me, but I need to do the more precise exercises that the physical therapist gives me, and I'll see even more progress. But I was in extreme pain when this is like my fourth episode that happened this past year. Debilitating pain. I was almost good for nothing as far as being able to work, do anything productive. I was on my way to the emergency room. The fitness center that is associated with Dr. Matt called me and said, hey, why don't you give him a try? Come down here right now. So on my way to the ER, I detoured and came here, and I'm so glad I did. I'm very, very pleased with the results that I experienced, and I highly recommend Dr. Matt.